This brings us to the last session of the day. It's been a tiring day for a lot of you who had delayed flights, completely unprecedented delays. So we'll begin the session on first CMC arthritis. It's a symposium, and I invite our first speaker, Dr. Anil Bhat, to speak on the biomechanics of CMC joint. Is congruency necessary?
Good evening, all. The question was, is congruency required? And the downfall and the evolution of CMC joints started with when we started walking and started holding objects and attacking people. The evolutionary demand was for the less constrained joint, dexterity for precision, that's what was required. But then the price we paid was arthritis in not so typical weight-bearing joint. Gray's anatomy eloquently describes this as articulation by reciprocal reception. And functional paradox of mobility and stability both are seen in these. It's a saddle joint, which all of us know, but then it basically functions like a pivot joint there. And only 50% of the population show congruency. It's probably much more flatter in women. Opposition has the best contact, which is about 53%. In adduction, it reduces to 28%. In abduction, it reduces to only 25%. These are the movements, the saddle movement, which has a slide and a roll kind of mechanism there. And in flexion and extension, what happens is the extension basically couples with adduction, and then in the flexion, it couples with abduction. So this is what happens during these basic movements. And in palmar abduction and adduction, the slide and roll changes to a different kind of a degree, and that is the contact which happens during these movements. The ultimate, of course, is the kinematic expression is the opposition. And then what you see is much more, which is, that's the close packed position of the CMC joint, which is about 53% of contact which happens during this particular motion. And this predisposes the joint to potentially damaging pressures. In grasp, the metacarpal goes in for ulnar translation, flexion, and abduction. And in pinch, so what happens there is more of ulnar translation, internal rotation, and flexion in a pinch. So there are two different basic movements which happens there. So why does this joint get abused? Generalized ligament laxity, postmenopausal influence, skeletal architecture, intricate kinematics there, role of soft tissues, and joint reaction forces, which is almost 12 times in a grasp, and in a pinch it comes to almost 120 kgs. So there is the radius of curvature, which is totally disparate and is congruent on extremes of motion. As I said, it's about 53% in opposition. The secret lies in the joint becoming congruent when the joint wants to actually. However, it still remains shy of full congruency, lest it loses its dexterity and mobility. But basically, the whole congruency is sum of all parts, which means the joint, the ligaments, almost 16 ligaments have been described there, and then the muscles which act all together, giving the congruency. It's not just the joint. So it's kind of incongruously congruous joint for us. This lady with the bad CMC arthritis, totally incongruous joint. That's the presentation. Doing most of her activities, absolutely no pain and no limitation of movements. And then when we try to put in the congruency there, probably some amount of range of motion increases, but then otherwise it doesn't do much. So we don't know what are the answers. Is congruency required? Yes, but how much is the question? Congruency was compromised for mobility and dexterity as we evolved. This compromise is further affected by genetic, metabolic, and occasional factors. Nature had a balance, and the surgeons are still trying to find it. Thank you.
Thank you, Anil. That was very precise, and it reminds me of this wonderful book by Paul Brand on biomechanics of the hand, where he describes this as an eccentrically loaded saddle. It's a strongly recommended book. Thank you so much.
Thank you.